year?
I think there recently have been some statements made which probably go a little bit too far, saying that fat's not the enemy at all and that people should be able to. It gives people the impression that they can eat as much fat as they want. And the problem with fat is it's very calorically dense, and so you get lots of calories from high-fat foods. So I think that we've seen a significant decrease in coronary artery disease because of changes in diet that we recommended, but it's a lot more complicated than that. In this country, there is a huge epidemic of obesity and diabetes, and we'll talk a little bit tonight that if you have a population that becomes more overweight, the more weight they gain, the more they're at risk for developing diabetes. So it goes from obesity to prediabetes to diabetes, and that is an epidemic in this country. We started with an exercise program, and so at the Kroc Center we have a program called Kroc RX where we get people into exercise. And I've found that it's a little bit easier to get people started in exercise and then they become interested in their diet more than the other way around. A lot of people have tried dieting, they may lose some weight, they gain weight again, and they become frustrated by that. But if you get people started exercising, actually start losing weight, and then they want to increase that, so they start becoming very interested in what they eat. So we started with an exercise program at the Kroc Center, but we're now in the process of having an educational series that will be aimed at trying to reduce obesity, prevent diabetes, prevent prediabetes. And we're working with University of Idaho and the Panhandle Health District to bring in some nutritional lectures that will complement what we're doing with exercise. Once I get them into the exercise program, somewhere around the third week, if they lose a little bit of weight, and suddenly they're saying to me, well, when are we going to learn about diet? When are we going to learn about nutrition? So it has changed their mind, it has changed their attitude, and they see that they can have some benefit not only from the exercise, but the combination of diet and exercise.